Well, in Nutrients from 2016, this review was made about DHA. The effect of DHA, this is the part that mainly relates to the brain and the eyes. A large part of the brain is made up of this omega-3 DHA, and the development of the brain and the function of DHA. Well, here they state that in development, if there is not a sufficient amount of DHA, this will lead to cognitive problems, not only in the child, but also in the long term. They also suggest the alteration of possible psychiatric diseases. Therefore, this is the importance of being able to diagnose omega-3. This is done, as I mentioned, by measuring omega-3 levels in erythrocytes. It is a way to do it in the membrane of the erythrocyte, or even to do it in blood as well. That varies a lot. We need a more specific measurement, exactly, and why. Because if we find it low and we carry out a treatment, or we make a nutritional impact or use food components, we need to see that we have truly succeeded in another analysis. If we do not measure, we cannot know the impact of our interventions. In this systematic review, let us remember that systematic meta-analyses have the highest value of all scientific evidence because they take several articles for clinical trials and draw a conclusion. In this journal, this publication evaluates the contribution of omega-3 in people with rheumatoid arthritis. They found that in these individuals, the triglyceride count decreased, which is a well-recognized effect of omega-3. They observed that some inflammatory markers decreased in patients with rheumatoid arthritis, but not in all, as the conclusion is that they were able to confirm that triglycerides specifically decreased in these patients. In this review, the impact of essential omega-3 fatty acids along with B complex, vitamin C, magnesium, and zinc supplementation was evaluated in women with stress levels. This was a systematic review. They concluded that the administration of omega-3 was very interesting, especially in menopause syndrome and premenstrual syndrome. Magnesium and vitamin C could be useful as support for premenstrual syndrome. They even found that vitamin B6 alone could help reduce anxiety in older adults. They also evaluated that high doses of vitamin C could reduce anxiety and mitigate the hot flashes or spikes in tension related to stress. This is what they were able to demonstrate. So, when we see there is quite a bit of evidence supporting dietary supplements in health, we lack training to be able to prescribe them properly, to see their interactions, because obviously they are not harmless, although they are very safe, but every therapeutic action has the potential for side effects, although in supplements it is minimal. And also to make more approaches, professionals should always study interactions, including therapeutic ones, whenever we obtain a supplement. In this 2013 review in Clinical Nutrients, the impact of supplementation on dementia, which is obviously very common, was also evaluated. This is a systematic review of a meta-analysis, and they then found that the supplementation of shakes with nutrients or dietary supplements had a positive effect on these patients for weight gain and also in improving cognitive status. Well, now vitamin D3, which by the way is being talked about a lot due to the situation we are experiencing. Why? Because it is a vitamin that has an immunomodulatory effect. It is not only related to calcium, which is how we primarily recognize it, but it also has an effect. Regarding immune modulation, the guidelines developed by the National Osteoporosis Foundation in 2014 recommended a vitamin D intake of 800 to 1,000 international units daily, along with calcium, to prevent osteoporosis in adults over 50 years old. Okay, we need to review that because sometimes we are using a dose of 800 or 1,000 units. We do a blood test and see that we reach an ideal value. In the blood of vitamin D3, which should be above 30 or 40. So it is let's say, a safe dose that they recommend, which can benefit most of the population, but we must individualize Oral intake of vitamin D3 with calcium supplements may decrease postmenopausal bone loss, help prevent osteoporosis, and reduce the risk of fractures. So we already have several prevalent diseases, such as osteoporosis, which, as we know, carries the possibility of having more fractures. However, we have an approach using dietary supplements that has significant supporting evidence. Thank you. Obviously, any therapeutic approach must include not only dietary supplements, but also proper nutrition counseling, exercise, and stress management. This is within the framework of an integrative therapy approach, but supplementation has, in my opinion, an important hierarchy to better support patients. According to a meta-analysis, the daily oral intake of vitamin E3 between 700 to 800 international units, with or without calcium, poses a risk of fractures in the elderly, both in outpatient and institutionalized settings. So we have a very clear supportive approach for elderly patients. The journal Pediatrics Allergy Immunology evaluated prenatal vitamin D, maternal vitamin D status, and the impact of respiratory infections and allergies in children. It is a meta-analysis of observational studies. So what did they find? That the introduction of public health measures to address vitamin D status during pregnancy is necessary. It can reduce the incidence of respiratory infections in children. In other words, imagine the impact, even the level of vitamins, in this case, vitamin A3 in the mother, will condition, in this case, the respiratory infections in the children. This means that we should already be measuring these vitamins more during pregnancy in order to make an impact through nutrition and supplementation. In the Business Medical Journal, a high-impact journal, this meta-analysis was conducted, which is a systematic review and meta-analysis of randomized studies, as well as observational studies, meaning it is of high evidence. What did they conclude? Thus, observational evidence from studies indicates that there is an association between the amount of vitamin D3 in blood and the risk of death due to cardiovascular diseases, cancer, and other causes. Here, a dose-dependent relationship was found. It is not causal, obviously, but when there is a relationship in which the dose changes that relationship, it is referred to as a strong relationship. Therefore, supplementation with vitamin D3 could mean a reduction in mortality among older adults. They obviously also recommend in this article that before making a widespread recommendation to supplement with vitamin D3, it would be necessary to investigate whether it is ideal to provide D3 or D2, as well as the dosage and the effects this could bring. So generally, the articles, if I find it appropriate, provide a cautionary ending, a disclaimer, but we also have to see that a correction of vitamin D3, the impact and the possibility of side effects are minimal, almost non-existent, if appropriate doses are administered. However, we see the impact it can have from the perspective of mortality in the studies that have been conducted.